The pectoralis minor muscle. The pectoralis minor is a small muscle that lies beneath the larger pectoralis major in the lateral chest region. The location of this muscle is in close proximity to the brachial plexus of nerves and arteries that exit the trunk to supply the arm. This muscle functions to position the shoulder girdle for movements of the shoulder joint. It may also assist inhalation by lifting the rib cage. Here are the landmarks for the pectoralis minor. First, we have the scapula, the clavicle, and the sternum. The pectoralis minor originates on the second, third, and fourth ribs and inserts on the coracoid process of the scapula. Contraction of the pectoralis minor produces scapular protraction, which is movement of the shoulder blade forward and outward, also produces scapular depression and inhalation by raising the ribs. The pectoralis major is synergistic during scapular protraction. The latissimus dorsi is synergistic during scapular depression, and during inhalation, the levator scapula, scalenes, sternocleidomastoid, and pectoralis major are synergistic. The trapezius and rhomboid are antagonistic during scapular protraction, and the levator scapula is antagonistic during scapular depression, and lastly, the intercostals are antagonistic during inhalation. Here are some associated symptoms for pectoralis minor trigger points. Your clients will complain of pain in the anterior shoulder and chest regions. A tight pec minor muscle can also cause neurovascular entrapment in the armpit region, and this can cause pain, numbness, tingling, and edema or swelling along the inside of the arm, forearm, and into the hand. Trigger point activating and perpetuating factors for the pec minor include car accidents, impact trauma directly to the chest, use of crutches, severe coughing, high levels of anxiety, carrying a heavy bag with a strap over the shoulder, and the head forward rounded shoulder posture. Referred pain from both the pectoralis major and the scalene trigger points is very likely to activate trigger points in the pectoralis minor muscle. Some common misdiagnosis for active trigger points in the pec minor include thoracic outlet syndrome, C7-C8 radiculopathy or disc herniation, bicipital tendinitis, medial epicondylitis or golfer's elbow, and supraspinatus tendinitis. To locate and release the pectoralis minor trigger point, begin with the client supine and ask them to place their near arm palm up on the upper part of the table, and if they're female, ask them to cover their breasts with the other hand. Sit or stand next to their armpit region. Grasp the outside margin of the pectoralis major muscle and displace it towards the client's chin. While holding the flesh back with one hand, slip the fingertips of the other hand very gently underneath the pectoralis major muscle. To confirm that your fingertips are contacting the pectoralis minor, ask your client to raise their shoulder off the table momentarily. You should feel the muscle contract as they do so. The trigger point typically lies over the third rib and refers pain to the anterior shoulder and to the chest regions. Use client feedback to help you locate it. Using your fingertips, apply pressure to the trigger point at a downward angle towards the table. Hold the pressure for 6 to 8 seconds and repeat 4 times. Slowly remove your hands when you're finished. With the client supine, grab the bulk of the pectoralis major muscle and pull it towards your client's chin. With the other hand, reach underneath the pectoralis major muscle with your fingertips to the pectoralis minor trigger point, located directly on the third rib. Apply pressure down towards the table and hold 4 to 6 seconds. Release very slowly and repeat, pulling the pec major back. Reach underneath, directly on top of the third rib. Apply pressure down towards the table and hold. And then release slowly. Repeat this whole procedure 4 times.